Hello and welcome to Marriott MBA Today. I'm Frank Cho, and today we're here with Todd Wight to talk to us about the healthcare industry and his experiences thus far. So Todd, talk to me a little bit about your internship experience.
Yeah, this summer I did an internship at Kauai Delta Medical Center. They're a large health system, or I guess a large hospital in Central California near Fresno. 581 beds and several hundred in revenue annually. And I had a really cool experience. I got to report to the CEO of the hospital and attend the executive team meeting, so I got a lot of exposure that way. And I got to work on several projects in operating room efficiency, so I looked at inventory management and turnaround times, and a lot of things you hear about in advanced no's first semester class. And then I worked on resource utilization, so kind of talking about, sometimes patients say, how often you got to prick my arm and get that blood test done? Well, with all the tests, we kind of ask the same question, how often do we really need to do that? Can we save a little bit of money and increase safety if we do less stuff to patients? And then I also got to study the organization's culture of quality and patient safety, and that was a lot of fun, and got to work with several directors and the executive team on that. And then I also did kind of your traditional feasibility financial analysis they have their own cogeneration plant that produces their own electricity, and so I got to study whether or not it made sense for them to expand it. So I had a ton of fun. And
it sounds like you had a really broad experience there.
Yeah.
But why specifically the healthcare industry?
To be honest, I'm really attracted to difficult problems. It's fun for me to take something hard and say I made a difference. And the healthcare industry is definitely fits that bill. There's a lot of challenges right now in the industry, but at the same time, it's a meaningful industry to make an impact. You think about the amount of spending that goes on. It's 18% of our GDP. They estimate about 6% of our GDP, or $800 billion, is wasted spending. But our outcomes are not any better than any other country. In fact, they're worse. There's various estimates about 50,000 to 100,000 preventable deaths a year, and many more injuries and poor outcomes. And there's just not a lot of correlation between the spending and the outcomes. And so I know that for anyone who works in the healthcare industry, they're very passionate about making a difference, not only in the economy, but in people's well-being.
It's amazing because it really does have such an impact on people's lives, more so than other industries. Todd's been instrumental in the organization of the Healthcare Management Association. So can you tell me a little bit more about that? Yeah,
so I actually started thinking about getting heavily involved in the Healthcare Management Association last year when I was at Nishimba. One of the recruiters asked me, I see you're in these clubs. What are you doing in these clubs? And I don't know if I could say anything more than I had, paid my dues at the time. So that was a moment when I said, next time someone asks me this question, I'm going to have a story to tell them about something I've done. So over the next couple months, I met with a lot of students, and we had some really interesting conversations about healthcare, and I found out that there was a demand. A lot of students that were interested, and so we started meeting, and eventually we merged with an undergraduate organization, the Healthcare Management Association, and so now it's a unified organization across the entire Marriott School with students in the different programs that attend our club. And over the last year, we've had about close to 24 executives come and visit and tell us about the interesting events going on in the industry, and it's provided a lot of networking opportunities for the students involved.
That's great, and it's very awesome that you're able to bring in the undergrads and have it as a whole school. We hear a lot now that there's reform in the healthcare industry, and I'd like to hear what you feel some of the challenges and opportunities are in the industry, and also what your MBA is going to be able to help you with.
Yeah, that's a question that's on everybody's mind right now. There's a lot of external pressure on the industry that they haven't really seen before. For example, if you go 5-10 years ago, all the variation in revenue for a hospital could be explained by their volume. Now it's probably about half their variation can be explained by volume, and now it's influenced by things like quality of care, what kind of outcomes do you have, and patient satisfaction. And so healthcare organizations are really working hard today to shift their focus to a volume-based organization in the past to a value-based organization. And to answer your question about how can the MBA help with that, well, we learn a lot of skills in the MBA program that help us understand business models and financial principles and operational skills that can really influence an organization to be better. And I think that our MBAs are young, they're ambitious, they're excited, and they want to make an impact. And so somebody who has an MBA really has the chance to go in and make a big difference in the healthcare industry.
A great industry to make a difference in, especially now we hear in the news a lot about the Affordable Care Act and bringing lots of changes to the industry as a whole. Any thoughts as we conclude that might be able to help us moving forward to understand what's going on?
Well, I mean, there's so much going on, and even during my internship when they presented the budget, they said, there's so many things we don't understand, and we could be anywhere on the map. It's the most complicated budget we've ever seen. So even the people inside the industry are having a tough time making sense of the new healthcare law. But I think there's an emphasis overall in shifting risk from the insurance companies to the providers. In the past, if somebody has a bad outcome, the insurance company takes that hit. But they're forward-thinking organizations are trying to absorb some of that risk in order to be the people who 5-10 years from now will be the leaders in the industry. And I mean, at the same time, there's also been some dramatic changes to the way insurance is being played out. The Medicaid expansion potentially could take away from those who are going to be commercially insured. And I mean, the commercially insured patients, typically bring more revenue to the hospital. Medicaid brings low revenue. So healthcare organizations are worried about how are our margins going to change with such a dynamic time. But obviously, any company right now is asking themselves the same question: how are we going to manage our employees? So I think there's a lot of questions that are still up in the air, but
you're there to answer them for them.
Yeah, we'll see what I can do.
All right. Well, Todd, thank you so much for being here. And thank you for joining us on Marriott MBA today. We'll see you next time.